All right. Good morning, everyone. Welcome to this new episode of Pablo Baglioni's podcast. It's Sunday, December 1st, and we'll be discussing several topics, with renal denervation being the most important. Subscribe to the YouTube channel. Before we dive into today's topic of renal denervation, I'd like to share that last month I visited Merrill's new offices in Madrid, as they invited me to their grand opening. I had the pleasure of meeting Dr. Pedro Martin Lorenzo and Andres Sanchez from Negrin Hospital in Las Palmas, Gran Canaria. They were truly excellent people, top-notch, all of them. The next day, we visited Dr. Ignacio Amat's service in Valladolid. What can I say about the people we met there? The technicians, nurses, doctors, fellows, all excellent. 10 out of 10. They treated us wonderfully. We got to observe many cases using Merrill's new Octave Corp valve. It was all really impressive. We also had the chance to enjoy some great food. Thanks, Nacho, for those invitations. We really had a wonderful time. I'd like to invite you to the upcoming My Valve for All event led by Dr. Pedro Lorenzo and his team from Negrin Hospital, happening on December 11th and 12th in Las Palmas de Gran Canaria. The event will be both in person and virtual, so don't miss out. Now let's move on to today's main topic. This article appeared in Eurointervention's state-of-the-art issue. As we know, Medtronic's Simplicity Spiral is the top device for renal denervation. It's FDA approved, as is Record Medical's Paradise, which uses alcohol ablation. Both have undergone numerous trials. They treat main accessory arteries with diameters of 3 to 8 millimeters. The spiral covers 6 fronts and the other 7 fronts. This is the box we all take photos with. The console shows the temperature of the 4 electrodes, and this catheter here has gold electrodes. There are 4, and the next slide shows how these catheters and electrodes are placed in different artery branches. I want to thank mainly Dr. David Gonzalez Calais from Rio Ortega Hospital in Salamanca, who sent me this photo, and my friend Dr. Javier Castro, who performed our first renal denervation case while I was in Madrid, sponsored by Femani Medical, who are the Medtronic distributors here in Argentina. Well, as you know, the antihypertensive effect of renal denervation is due to sympathetic nervous system modulation by interrupting afferent and efferent renal sympathetic nerves in the adventitia and perivascular fat of the renal arteries. It's been over 10 years since the first renal denervation treatment trials began. As you may recall, the Simplicity HTN3 trial proved the procedure's safety, but failed to show superior blood pressure reduction using this single electrode radiofrequency catheter device. In hindsight, these first-gen placebo-controlled trials provided valuable insights for designing new studies, as we'll see next. A thorough review of these trials, new understanding of renal nerve distribution, improved catheter systems, and new devices have paved the way for next-gen clinical trials. The autonomic nervous system regulates cardiac output and blood pressure to maintain organ perfusion. Increased sympathetic nervous system activity raises blood pressure through various mechanisms, including peripheral vasoconstriction, reduced venous capacitance, and decreased renal sodium and water excretion. Sympathetic activation affects blood pressure. The rostral ventrolateral medulla affects all peripheral organs. Kidneys play a key role in regulating blood pressure. Sympathetic nerves from abdominal ganglia follow renal arteries, converging on the outer arterial layer from proximal to distal portions. Activating sympathetic and renal nerves triggers renin release via beta-1 receptors in juxtaglomerular cells. It boosts sodium reabsorption in kidney tubules via alpha receptors and reduces renal blood flow. Renal afferent nerves react to kidney injury and pelvic pressure changes through specific receptors. The Simplicity spiral system, through this multiple clinical trials have been conducted, including Spiral HTN, which began with 2 international, multi-center, placebo-controlled pilot studies that tested this new catheter. Each trial included 80 patients with mild to moderate hypertension. One trial, Spiral HTN on med, used medication. The off-med trial didn't. Both trials showed significant blood pressure reduction after renal denervation, with minor changes in the control group. Subsequently, 2 other international trials were conducted, also randomized and placebo-controlled, prospectively designed to detect changes in 24-hour systolic blood pressure in patients with mild to moderate hypertension, either with or without antihypertensive medications. These were the expansion and pivotal trials. These trials used an adaptive Bayesian design, including 80 patients from pilot trials as prior data, with interim analyses for early stoppage. The Spiral off-med pivotal showed RF renal denervation's superiority over placebo in lowering BP without antihypertensive meds. Primary and secondary efficacy outcomes were met compared to the control group, with denervation reducing 24-hour and office systolic blood pressure after 3 months by 3.9 millimeters of mercury. Unlike the other trials in the Spiral HTN program, on-med expansion didn't show a significant difference in 24-hour systolic blood pressure treatment between renal denervation and control groups at 6 months. While 24-hour BP drops in denervation groups were consistent across trials, the control group's reduction was unexpectedly large. Predefined analyses showed disproportionate medication increase in the control group up to 6 months, especially in US patients. Also, 24-hour BP patterns differed greatly between patients enrolled before and during the COVID-19 pandemic. Due to these group differences, almost all data from both control and treatment groups were excluded from the primary analysis. We must also highlight that several secondary efficacy outcomes were met, including office systolic BP reductions, a difference treatment adjusted by nearly 5 mmHg systolic and 2 mmHg diastolic, which were greater in the denervation group than in the control group. When analyzing hourly changes in ambulatory systolic and diastolic BP, nighttime reductions were larger in the renal denervation group than in the control group, while daytime reductions were almost identical. These nighttime BP drops were crucial, as they're closely linked to adverse cardiovascular events and hypertension-related target organ damage. Long-term follow-up data from the Global Simplicity Registry suggest ongoing blood pressure lowering effects during a patient. The Spiral Affirm trial is currently assessing the long-term safety and effectiveness of the Simplicity spiral catheter system with 1,000 global patients who have uncontrolled hypertension. It's designed for subgroups including type 2 diabetes, isolated systolic hypertension, and chronic kidney disease. Current European Society of Cardiology guidelines consider renal denervation as a treatment option for patients with resistant hypertension and those with uncontrolled hypertension, despite using combination therapy with antihypertensive medications. Lastly, here's a brief summary of current treatment guidelines, the devices being evaluated, and the two I mentioned earlier that are FDA approved. It's important to note that this procedure is safe. Ultrasound-guided puncture and a percutaneous closure system are recommended. Proper patient hydration, vital sign monitoring, heparin administration, and good analgesia with an anesthesiologist present are crucial. Well, that's all for today. Thank you and see you in the next episode.